Hello, my name is Navid Zadeh, and in this clip I'm going to demonstrate a couple of good techniques and exercises for managing a forward head posture. As we might know, a forward head posture is a poor habitual neck posture. It is usually caused by repetitive tasks by using different computer devices and a smartphone. It often coexists with upper cross syndrome, and usually your neck is not aligned, which is due to hyperflexion in lower cervical and hyperextension in upper cervical vertebra. Now, due to increased comprehensive forces throughout the neck joint and increased muscle tension, the symptoms are pain, discomfort, tension, and pain and pins and needles in hands and finger. There are certain muscles which are responsible for this problem. The main one is trapezius, and then we are having some other group of muscles such as rhomboid, which get weak, and levator scapula, which rotate your head side to side, and then you have scalenes, which are also turning your head side to side and side bending, and sternocleidomastoid. And also we have suboccipital, which is the back of the head, usually get tight and tense, and we have neck deep flexor, which are the main stabilizer of the neck, and also pectoralis minor can become very tight and tense. So in order to manage this, we have to release certain muscle and strengthen other group of muscle, which can be quite challenging. Now, one of the most effective method is by releasing the tension in tense muscle and strengthening weak muscle. One of the way to release the tension in muscles such as the trapezius and occipital is by self-massage techniques. Put a tennis ball behind your head and roll it side to side and up and down as shown in the video. This can be a good friction for suboccipital, which is quite tight. And also you need to focus on your posture by changing your habit. Now, firstly, we have a chin tuck here, which you can do either in lying down position or in standing. Put your finger on your chin and tuck in for 30 seconds and repeat 3 times. So you can do either in lying down position or in standing. Breathe deep in and out, repeat 3 times. And the next one is a good strengthening exercise for trapezius and rhomboid. Lying down on your stomach and raise your hands towards the ceiling, which you should repeat 2 sets of 15. The first set without weight and the second with 1 kilogram weight. Try not to hold too heavy weights, as this will not be efficient and unnecessary. Also, you can bring your hands up and hold for a good 20 seconds as isometric one. The next one is butterfly movement, firstly without weight and with. Repeat 2 sets of 15 and breathe deep in and out. This is a good functional exercise for entire scapular mobility and strengthening of those muscles. The next one, stand in partial lunge position, lean forward and bring your shoulder at 90 degrees, holding weights, which will strengthen rhomboids and the other muscle between the scapula. For the next one, similar to the last one, keep your elbow and shoulder at 90 degrees and push them backward by retracting your scapula. 2 sets of 15 will be very good. Next, while pushing your scapula backward in the last exercise, elevate your hand upward Also 2 sets of 15. Now for some static resistance exercise, put your hand above your ear and push your head into the hand. This is a very good isometric exercise to build strength, and repeat this 3 times on each side. Hold 30 seconds. On the other side. Then do this exercise for the back of your head, then the front. Using your palms for 30 seconds, 3 times. Moreover, improving your ergonomic adjustment and desk setup when using devices will obviously also help prevent neck tension and discomfort. Now for some stretches. Firstly, as you can see, here is the stretch of pectoralis, which also help to release the tension. And the next one, simply put your hand, pull your head down towards your chest to release tension in the occipitals. Then put your hands together and lean forward. To stretch those muscles, you need to do on regular basis. Then to stretch the trapezius, fix your hand on the side of your head and use the other hand to hold onto a seat. Then pull your head away from the seat as shown here. There is also standing position. Hold your head and pull to the side. Stretch head and neck to the other side.